Thank you. A couple of months ago, my son Jack, who's 5 years old, he said to me, "Daddy, I'm starting a new business." And right then at that moment, he was busy drawing lots of pictures of cartoon characters and video game characters on lots of sheets of white printer paper, and they were piling up around him. And so I looked at him and I asked him, "Jack, how much are you going to charge for a picture?" And he quickly said, $100. And then he added, "But these pictures aren't for sale. These pictures are for kids in the hospital." So I asked him, "Jack, why are you going to give pictures of angry birds to kids in the hospital?" And he looked at me like that was the craziest question anybody could ask him. And he said, "Because it'll help them feel better." So I realized Jack is on to something. Jack had come up with a good idea, his business, and his business was going to help other people feel good. And in return, that was going to help Jack feel pretty good himself. And Jack owned that idea. And so it got me to thinking, what things do I do in my life? What things do I own that help people feel good and feel a little bit better, and in return make me feel good about it? And so I'm a researcher, and the first things that come to mind for me are the research projects that I'm involved with. Some of the research that I do has to do with making video games and mobile apps and evaluating these with people that help individuals in and out of the hospital feel a little bit better. And it's important research, it's fun, it's interesting, and the fact that it helps people just a little bit makes me feel pretty good. But the more I thought about this, the more I realized that the good that I'm most proud of is the research that I've participated in for other people. And I don't mean as a collaborator, I don't mean as a co-investigator, I mean participating as a research subject for other studies. Participating as a research subject is super easy. It's easy to do, and you get the reward of helping them make a great discovery. Doing your own research is hard. Participating in research is easy. All I had to do was fill out some surveys, or be interviewed, or donate blood. And I've helped researchers in studies help reduce racial disparities in science and technology education. I've helped researchers reduce bullying, to stop domestic violence, to help cancer patients. And I played a small role in each of these studies, but I get to own just a tiny piece of that innovation because they couldn't have done it without my help and without the help of 100 other volunteers. And so how would you feel how awesome would it be if you helped own a major medical discovery? These kinds of big discoveries happen. Let me give you a couple of examples of heroes, research volunteers, heroes, and amazing discoveries to illustrate what I'm talking about. Right now, we're conducting the first clinical trials for the first Ebola vaccine. And this is Nick. Nick is one of the first volunteers for the first clinical trials for the first Ebola vaccine. And you might wonder, why would anybody do this? Why would they volunteer to be in a clinical trial for an Ebola vaccine? And volunteers have lots of different reasons for what they do. Nick happens to work for a large international aid organization, and he's lost 10 of his colleagues to Ebola. And so maybe it's something personal. Or maybe Ebola is just a big, freaking scary disease that's on our mind right now, and helping to find a cure for it is one thing that you can do. And wouldn't it be awesome if Nick played a role in finding this cure? And so, by the way, you can follow Nick's experiences in the clinical trials for Ebola at Nick O. Owen. Another example goes back several years. This is Sister Catherine Frances Mallon. At the time, Sister Catherine Frances was a nun and an educator in the Detroit area, and she had been fighting her own battle with breast cancer for 7 years. She was in the hospital again, And a research assistant comes down to her and says, you know, excuse me, would you participate in a research study? She said, what we're trying to do is take human breast cancer cells out of the body and get them to live in the lab, which must have sounded pretty crazy back then. And the research assistant said, you know, we have to harvest the cells from your breast, and it's probably going to be pretty uncomfortable. And it might take a few tries because sometimes we can't get them right, we can't isolate them right. And by the way, you know, we actually haven't gotten cells to live outside of the body yet, and so it might not work at all. And most importantly, Sister Catherine Francis, this research, all this trouble that we're asking you to go through, isn't going to help you with your cancer. It could only potentially help women in the future. Still, Sister Catherine Francis consented to the research, and on the 7th try, they managed to isolate and harvest what we now know of as the MCF7, what you call eternal breast cancer cell line, the very first one. And this was a huge, huge breakthrough in the war on cancer. Now we have these cells that live in a laboratory where we can test new therapeutic agents on them without trying them out on a person first. It made clinical trials happen faster, it made discoveries happen faster, and when you did get to clinical trials, the trials were safer on people. And her contribution accelerated the frontline cancer drugs that we're using today. And she has literally helped millions of women over the past 10 years who had breast cancer. Now, since then, Sister Catherine Francis has since passed on, but her contribution to science and her contribution to women lives today, and through her cells, she will live forever. And she owns that discovery. Those are her cells, and I bet she feels pretty good about it. The key to owning a discovery and feeling good is something called research engagement. And to explain what research engagement is, I'm going to take a step back and talk a little bit about civic engagement. So civic engagement is an individual or a community's right to define their own public good, to define what's important, their right to seek that good, and their right to reform or replace institutions that don't serve that good. Similarly, research engagement is an individual or community's right to define their own research priorities, what's important to them. It's their right to set policies by which our researchers can seek those research priorities. And it's our right to reform or replace institutions that don't serve our research priorities. In other words, it's our research, so we better make it something that we're proud of. And just like civic engagement, with research engagement, it's not just a right, it's a responsibility on our part to look after it. We pay for research. We pay for it directly through our taxes. We pay for it indirectly through the products we buy, and we sometimes through personal contributions. So we already own it. We just need to start taking care of it, start making sure it's something we can be proud of. What you can do is we need to get our voices heard. We need to get out there and talk to a researcher, talk to a research funding organization, and let them know what you care about. One of the ways you can do that, there are new apps and new websites that you can go to. One that is getting a lot of attention right now is patientpowered.me. There's another one that I'm involved with called repavo.org, and they capture the voice of a community on what kind of research they're looking for. If you don't tell the public, if you don't tell a research organization, if you don't tell a researcher what you care about, they don't know. And there's a new emphasis on what we call community-engaged research, where listening to your priorities, what conditions you and your family think are important for us to work on, is becoming more and more prevalent And so don't be afraid to engage with a university, engage with a research organization, because they're looking for your feedback right now. And then once you feel like your voice is being heard, your priorities are being heard, find a research study that you can get behind and volunteer for it. But if you do volunteer for research, ask that investigator, say, when this is over, send me an email letting me know exactly what this study discovered, exactly what this innovation is. And then you'll know. You'll know what small innovation you helped to discover, and you can be proud of it and you can own it. So I was working with Jack. Jack was working with me on this presentation, and we've been talking about this a lot. Jack's 5 years old. And I wanted a little bit more of that innocent wisdom that he gave me that I described in the beginning of this talk. And so I asked Jack, I said, Jack, what do you think is the most important innovation, or the biggest discovery that we've made? You know, something that has helped the most people feel good. And he looked at me and said, I know, bungee cords. Which just goes to show you that, number one, kindergartners are very practical people, and number two, that we all have research priorities, and they're all different, and the important thing is that our priorities are heard and acted on so we can begin to own the research that we're paying for. Thank you.